Hello, my name is Dr. Norman Saffra, and I'm the Chief of Ophthalmology here at Maimonides Medical Center. I trained for medical school at the Albert Einstein College of Medicine in Bronx, New York, where I graduated towards the top of my class with special distinction for research in ophthalmology. I then went on to complete an internship in internal medicine here at Maimonides Medical Center, and then returned to the Albert Einstein College of Medicine for residency in ophthalmology. After that, I did fellowship training in surgical diseases of the retina and vitreous at Downstate Medical Center, and additional training in neuro-ophthalmology at Kingsbrook Jewish Medical Center. I think that I'm very privileged to be able to be an ophthalmologist, to assist patients in maintaining their vision and restoring sight to people who've lost their sight. To me, there's nothing more fulfilling than restoring sight to a patient, and I'm surprised that every physician doesn't want to be an ophthalmologist. My area of expertise within ophthalmology is really microsurgery. It's reconstructing eyes, it's repairing retinal detachments, removing cataracts. It's doing surgical procedures to restore or preserve vision. Today, preventive care is a very important part of healthcare. So there are some things that you can prevent with early detection and early treatment so that things don't get worse. There are other things that require surgical intervention. By nature, I'm conservative. I think that most patients appreciate a conservative approach because that's the way I would want to be treated and my family members would want to be treated. However, there are times that diseases require an aggressive approach, so it's difficult to give that answer absent a clinical situation in a particular patient. We are very fortunate to be living in a time of explosion of technology, personalized medicine. Today we have treatments for macular degeneration, which are new molecules that can destroy blood vessels. Where heretofore we either had no treatment or we had to use lasers to ablate people's retina. I think the advent of microtechnology and all these new personalized medical issues are going to revolutionize the treatment within medicine and within ophthalmology in particular. So, amongst other new exciting technologies that are on the horizon for ophthalmology is really sort of, quote, the bionic eye, retinal implants, new lenses for post-cataract patients, new implants for glaucoma, new medications, long-acting pellets that will release medications which won't require patients to take medications every day. There are so many new and exciting things in ophthalmology that the field today is markedly different than it was a scant 10 years ago. We have a multi-specialty group practice here on Medical Center campus. We specialize in the ophthalmic manifestations of systemic diseases, meaning people who have eye symptoms related to their underlying diagnoses, as well as people with primary eye disorders. With a team approach, we have the various subspecialists necessary on site to really handle almost any problem that exists. Fortunately, with the advent of technology, we have been the recipients of the most advanced technology for diagnosing and treating eye conditions on the spot. The downside is sometimes visits can take several hours, so a comprehensive examination and treatment can be quite lengthy. But the proof is in the pudding, and the end results are that we are doing amazing things here at Maimonides in taking care of patients with eye diseases. One of the amazing achievements that I can share with you is my daily experience with removing an eye patch from a patient's eye who's just had surgery, who can now see. When you talk about career milestones, I'm lucky enough and privileged enough to have that almost on a daily basis.